Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided all the topics in a systematic order, so you can also make use of it. So we have seen the fetal circulation and what exactly happens immediately after birth. So these changes all we have seen in the last class. Today we will discuss about the applied aspects of the patent ductus arteriosus, PDA. Now, physiological closure of the ductus arteriosus usually occurs within 15 hours after the birth in a healthy, appropriate to gestational age newborn. It may be delayed in preterm babies or low birth babies to some extent. But anatomical closure of the ductus arteriosus, that means completely, anatomically it is closed, that takes about 2 to 3 weeks. Okay, the true anatomical closure will take place after 2 to 3 weeks, but physiological closure will take place within 15 hours. The ductus arteriosus is a large vessel found normally in all the mammalian fetus, connecting the main pulmonary trunk with the left-sided descending aorta about 5 to 10 centimeter distal to the origin of the left subclavian artery. Okay, this position is very important. The diameter of this vessel is equal to descending aorta. Okay, quite big vessel. Okay, large vessel, descending aorta, while length may varies. During the normal embryological development, the sixth pair of the embryonic aortic arches, pharyngeal pouches, we have discussed it in detail, okay, persist as the proximal branch of the pulmonary arteries, and distal portion of the left sixth arch persists as ductus arteriosus. Well, explaining the vascularity of the development of the vascular system of the fetus in previous videos, we have seen this. Connecting the main pulmonary trunk with the left dorsal aorta, normally the distal sixth arch degenerate, and then the ductus arteriosus remains there. The microscopic structure of the ductus arteriosus is very important. It is quite different to that of the adjacent pulmonary trunk compared to any other arteries. The structure, microscopic structure of the ductus arteriosus is very different. That makes it different from the other arteries. Although the wall thickness is quite similar, a medial layer of the ductus arteriosus consists largely smooth muscle cells instead of elastic fibers. In other arteries, if you see in the medial layer, middle layer, there will be elastic tissues which is responsible for these pulsations and all, but constriction, pulsation. But here, the medial layer, it contains most smooth muscle cells. Largely smooth muscle cells are present. Contraction of these smooth muscle cells leads to narrowing of the lumen and shortening of the ductus aorta. When it contracts, it leads to narrowing of the lumen and as a result shortening of the ductus arteriosus. Now, ductus arteriosus is patent in fetus. Yes, we know that. Because of the exposure of the low partial pressure of the oxygen, that is 18 mm of Hg. This is what we are talking. Okay, because maternal blood when coming to the fetal body, it gets mixed with the impure blood many times. So now what happens is the oxygen level falls up to 18 mm of Hg. So this is very conducive for the functioning of the ductus arteriosus. This is one thing. Second is there is locally produced prostaglandins are also there. Prostaglandins are also produced that maintain the patency of the ductus arteriosus. And also why it is remain patent is locally the nitric oxide production is also there by the endothelial cells of the ductus arteriosus. Endothelial cells present in the ductus arteriosus, they also produce the nitric acid. So these three factors are responsible for maintaining the patency of the ductus arteriosus. Low pressure of the oxygen and then nitric oxide and then prostaglandins. The vasodilator prostaglandins, especially the prostaglandin E2, mainly play a part in maintaining the patency. In the prostaglandins also it is very specific, prostaglandin E2. Now, inhibition of the prostaglandin synthesis through the inhibition of the enzyme cyclooxygenase results in constriction of the fetal life. Now, this is very important. Okay, suppose if mother is taking any of the NSAID drugs, like maybe maybe indomethacin, etc. So basically, they are known to inhibit the prostaglandins, all type of prostaglandins. If the mother is taking as a painkiller or for any inflammatory purpose, if she is taking these drugs during the first month of the pregnancy or second or third month of the pregnancy, or anywhere in the pregnancy, so that have a bad effects on this ductus arteriosus, and ductus arteriosus prematurely get closed in the fetal life itself. Then it leads to so many congenital cardiac problems. After the birth, what happens is ppGE2 is metabolized in the lungs and its concentration rapidly fall within few hours, 3 hours. Okay, so the immature ductus in the preterm produces more prostaglandin and more sensitive to relaxant effects of the pGE2. Now, mechanism of the normal closure. In a full-term neonate, the closure takes place in two phases. Number one is smooth muscle constriction produces the functional and physiological closure in the few hours after birth. Second one is anatomical closure takes place few weeks after the birth, maybe 2 to 3 weeks. Now, steps in conversion of ductus arteriosus into ligamentum arteriosum. There is increase in the arterial oxygen concentration, as I explained earlier. More oxygen in the blood after the movement of the blood into the lungs leads to the drop of circulating prostaglandin level in the blood within the lumen of a ductus arteriosus. Meantime, there is stimulation of the baroreceptors. We have explained this also. So, reducible production of the nitric oxide is also there from the ductus arteriosus, causing constriction. So, all these three factors now favorable for the constriction of the ductus arteriosum. All these events leads to the constriction of the ductus arteriosum, which is called as functional or physiological closure of the ductus arteriosus, which occurs within 3 hours after birth. Now, the loss of luminal blood flow leads to the zone of hypoxia in the muscle media layer of the ductus. In the middle layer of the ductus arteriosus, there are smooth muscles are there. Okay, so now blood is not flowing there. So when the blood is not flowing there, there is no question of constriction and all. So this leads to irreversible anatomical closure. Okay, so there is death of the smooth muscle cells which are intensely present in that previously. Now it is undergo death due to hypoxia because no blood is coming there. Okay, due to hypoxia, the inducible growth factors. These growth factors lead to proliferation of the intima layer resulting in thickening. Meantime, profound endothelium also inhibit the prostaglandin secretion and the nitric oxide release, and thus permanently present to permanently close the remote chance of reopening. So there will be fibrosis and then permanent seal, which produce a fibrous band called as ligamentum arteriosum within 2 to 3 weeks, making the anatomical closure. So this is how it is physiologically and anatomically get closed. Now in the next class, we will discuss some of the important pathological aspects related to the patent ductus arteriosus. Thank you very much.